Good morning, everybody, to the First Lead Commission for the state of Maryland for 2023. I'm Ruth Ann Norton. I'm the chair of the commission. In my day job, I am the president and CEO of the Green and Healthy Homes Initiative. We've had a number of staff changes and different things moving around at the department, which will get everybody introduced in their roles. And as we go into 23, we will be moving from the Governor Hogan administration into the new administration for Wes Moore. I think I speak on behalf of the commission on the record to thank Governor Hogan for his work on behalf of the children of Maryland in advancing universal blood lead testing and his support for that work over his time and the good work of the agencies, which we'll hear from today. As we go into the year, we'll also have an awful lot to be talking about monies coming down for lead and water, environmental justice monies, and we will look to see the new platform for the new governor, who I am going to invite to speak to us, if he can, in the February or March meeting of the commission to say a few words on his own commitment to this issue. I know, unless somebody else knows more than I do, we are awaiting the appointments of the new Secretary of the Environment. And I know we all look forward to that, as well as the Secretary of Health, Housing, and all of the other departments here. But if we can, to start out, I want to just ask, number one, I'm going to do something a little different. But if you're new to these meetings, before we introduce the commission, we'd like to know who you are, and thank you for joining us. So if this is your first commission meeting, could you please go off of mute and just introduce yourself?
I can start. My name is Maria Prawiro Diharjo. I am from Maryland State Department of Education, Office of School Facilities. Today I'm sitting for Jillian Storm.
Fantastic, and so glad to have you. Thank you.
Thank you.
Good morning. This is Will Doyle calling in from Howard County Health Department.
Wonderful to have you, Will. Thank you. I think it's rare that we have Howard County on, so we're so glad to have Howard County at our meetings. So thank you.
Thank you.
Yeah, this is Paulette Hammond from the Maryland Conservation Council. I'm just checking in with you. I got an invite and I'm just trying to find out what you all are about and doing this year.
We are so glad to have you as we address the issues that are related to lead poisoning from all sources across the state. Anyone else that's new to these meetings?
Good morning. This is Stephanie Statz. I'm the Field Office Director for Baltimore for the U.S. Department of Housing and Urban Development.
Welcome, Stephanie. Still look forward to getting some time together. And I know you've got a lot of new money coming from on the lead and healthy homes that we'll look forward to hearing from your office. And I think people will utilize the office. This is the office previously held by Carol Payne, for those folks that know. Stephanie, you've been in for now about 6 months. Is that right? Or somewhere around there?
It feels like 6, but it's a little closer to 3.
All right. Well, we welcome you and thank you so much.
Thank you.
Anyone else?
Good morning, everyone. My name is Kylan Simpson. This is not necessarily my first commission meeting, but this is my first meeting in a new role as an environmental health liaison with the Maryland Department of Health. So I'm happy to be here today. I'm looking forward to a great year with you all.
Well, Kylan, you're amazing. We're so glad to see you. Welcome to these meetings. What are you liaisoning to?
The local health department.
Huh?
So Kylan is here so that I don't run amok.
Okay.
He is actually going to be working with me as a liaison to local health departments, particularly on environmental health issues.
Fantastic. Well,
hey, Cliff, that means Kylan has the largest job of anybody on this call.
And Adam, I think we can make a motion to put Saint in front of his name from the beginning of the call.
So moved.
It is so wonderful to be amongst friends,
Yeah.
really.
Absolutely. Okay, any other newbies or fairly newbies who want to introduce themselves before we go to the quick introductions of our commission? Okay. So Adam, we're going to start with you. I'd love for the commissioners to introduce themselves to the public for the record before we get into the agenda, please.
Sure. Adam Skolnick. I'm the executive director of the Maryland Multi-Housing Association and commission member.
Great. Cliff, you want to go?
Clifford Mitchell, Director of the Environmental Health Bureau, Maryland Department of the Environment.
Great.
Oh, maybe Maryland Department of Health. Some department.
There you go. Great. Barbara?
Sorry, I still muted. Hi, I'm Barbara Moore. I'm nurse practitioner and director for the lead poisoning program at Mount Washington Pediatric Hospital.
Great. And Mangela?
Good morning. Happy New Year. I'm Angela Paul, nurse consultant for the Office of Child Care at Maryland State Department of Education.
Great. Thank you. Happy New Year. Christina?
Hi, sorry, I'm a little under the weather.
Oh,
Of the Maryland State Child Care Association.
so glad to see you. Fred, Frederick, who's the representative for MDE?
Tyler Abbott should be on. He's the director, but I'm here from MD.
Tyler, I missed you there. Tyler, you want to introduce yourself?
Sure, not a problem. I'm Tyler Abbott. I'm the director of the Land and Materials Administration here at the Maryland Department of the Environment.
Fantastic. Jack, is he back? He had to go out for a quick meeting. Jacob?
Hi, good morning. My name is Jacob Benzaken. I'm a commissioner. It's my second year, and I own JBC Management. I'm happy to be here. Wishing everybody a happy New Year.
Happy New Year. Mary Beth Haller, I think you're the actual representative for the city. Is that correct?
That's correct. Oh, and I'm the deputy commissioner for youth wellness and community health at the Baltimore City Health Department.
Baltimore City.
Good morning, everybody.
I was with your commissioner last night. Paul Rogers.
Good morning, everybody. Happy New Year. I'm North Developmental Pediatrician, representing the American Academy of Pediatrics Maryland chapter, currently with the ECHO project that I will talk more about later on.
Fantastic. Wendy, did I miss anybody? Anna Davis.
Paul is not on today. Yeah, Anna's here.
And
Anna?
Yes, hi, good morning. Happy New Year to everybody. I sit on the commission as the child advocate. Happy to be here.
Fantastic.
And Susan Kleinhammer?
I don't see her.
Yes.
She's
Yes, good morning.
Anita.
Yeah, good morning. This is Susan Kleinhammer. I am the CEO and president, owner of Lead Tech Services, a private training provider for lead courses, and a commission member.
Fantastic. And Benita, did I get you? Benita Cooper?
Benita, you're muted.
I'm sorry. Good morning. I'm a commission member representing the Maryland Insurance Administration.
Fantastic.
Did
Well,
we get Mary Beth?
We did get Mary Beth.
Okay, I think that's everybody then.
And if we could put up the agenda, and as we do, the one thing I'm going to make an appeal to this commission is that on the 9th, there is a town hall meeting on the transition from the Hogan administration to the Moore administration for funding around healthy housing, home repair. That includes lead, both lead in water and lead paint and those related issues. I want to make sure that we make sure that people know that we would like to see as many lead advocates on that call in the town hall to provide input into Department of Housing, Community Development, and the Housing Policy Transition team for the new governor. You can sign up for that town hall and pose your questions to be discussed at moremillermd.com. This is not a political thing. This is all about the transition to new government. It is part of the government function to make that transition. And we are looking for input and ideas on how to improve and make more equitable and more effective the work that we do on home repair around issues of lead and the good work that Jack Daniels and others are trying to do. But how housing policy also affects the work you're doing. And even if it's a cross-sector idea that goes from the environment to housing, and I would encourage you, for full disclosure, I am a co-chair of the housing transition team. But we want to make sure that the public is fully invited and fully engaged from all parts of the state, and would appreciate anyone who has time to contribute ideas or to participate in that town hall as the new administration takes hold. So and Wendy, I don't know if you can put it into the chat, More Miller MD.
Let's hold on. More MOO, what is it?
MOORE MILLER MD .com. They're not a bunch of doctors. MDs from Maryland. But Paul, it sounds like a pediatrician group, but then it More Miller MDs. Anyhow, we have to get to a couple of things for housekeeping, which is the approval of the minutes both for November and December. And this tells you how much we depend on Wendy, and want to thank Wendy for all of the great work that she does in support of the commission. She wasn't with us in December, and Wendy, we couldn't function without you, so we couldn't do them. But if you have read the minutes and have any questions or comments, now's your time.
Do you want me to pull the minutes up or just keep the agenda on?
You can pull them up if you want. Anybody missing off of that, misquoted, needing anything? And if not, do we have a motion first to adopt the November minutes?
So moved.
Do we have a second?
Second.
Great. All in favor of adopting the November 22 minutes of the commission, please say aye.
Aye.
Opposed? Okay, the minutes are adopted. For December 22, thank you for everybody who was able to fit us into the busy holiday season, and thank you, Cliff, for helping to chair that meeting. I think that's the one you stepped into a bit. And if you don't have any questions or comments, do we have a motion to adopt those?
Move to adopt.
Second?
Second.
All in favor?
Aye.
All opposed? Great. Wendy, if I could ask that at least for the next meeting, if we have an attendance report for the public for the attendance on meetings for 22, and to ensure that we getting all of our, we need to get our positions filled. That's been a longstanding issue here, and also outreach for those who are not able to attend. You know, we're coming into a legislative session, and to that end, I would like to know, is there anyone representing Senator Carter or Delegate Natalia on the phone?
I don't think that there's any representatives here, Ruth Ann.
Okay. With the commission's consent, I'm going to try to talk to both the Speaker's office and to the delegate and the senator, and Speaker's office and to the Senate president to ensure we get representation, because it will be very important moving forward. Okay. So we have for our calendar for 2023 an update from DHCD on the lead grant programs. Jack, have you returned to the meeting? Okay.
Yeah,
can
Karen
I-
did. Oh, is he back? No, he's not back. Okay.
So one thing for the commission that I really want to do is have a letter for the next secretary on a couple of things that I'd like us to discuss. And Cliff, this will be important to you as well. But one is on urging the next Secretary of Housing and Community Development to look more broadly at their resources as they look in community to support work in buildings that may come and cross into the purview of the Department of Housing and Community Development. That includes how they may even cross over in some of the building rehab, even childcare centers when it comes into the community development realm, and to take seriously the issues of how they address lead. And also, secondly, to encourage the next secretary to go after federal funding for other parts of the state for lead and healthy housing, particularly because the state's housing department is about to receive a triple whammy on climate dollars and weatherization dollars that are not useful to residents unless we can address health and safety. And we don't have enough health and safety dollars to make this workable on the Eastern Shore in Western Maryland, Cecil County, Howard County, and other places. And while we have resources within the city of Baltimore, to some degree, we have very few resources outside of the city to be able to address these issues. I wanted to just get some comment on that, and also for the housing department to have a strategy on how it's going to incorporate lead and water in as it moves forward. And we had a wonderful presentation by MDE. And lastly, Cliff, I see your hand, but before we get there, you know, I would like to urge the department to increase with the governor the match for the children's health insurance program and put some guidelines on that, on how we apply those dollars. But Dr. Mitchell, see your hand, open comment for that.
Thank you, Madam Chair. And the Commission on Environmental Justice and Sustainable Communities and the Children's Environmental Health and Protection Advisory Committee had a joint meeting in Camille, December, I want to say. It strikes me that there's been a lot of engagement between the Department of Health and the Department of Housing and Community Development on the issue of health and housing generally. That crosses from the statewide integrated health improvement strategy, which is looking at maternal and child health, opioids, diabetes, community development, climate, and various other issues. Health equity, writ very large in terms of health and housing disparities and the relationship between them. And I think either I or somebody else made the suggestion that the sort of strength in numbers and looking for these not as piecemeal approaches, but as comprehensive approaches, it might be worth having the Lead Commission and the Children's Environmental Health and Protection Advisory Council and the Commission on Environmental Justice thinking about the intersections of those issues with respect to children's environmental health, housing and health equity, and lead as part of that. There might be some thought to a joint statement or a joint resolution related to the integration of health and housing as it relates to children's health and to community health.
I would encourage and welcome that. I think it's really important. And I think now is the time to do things to help set a tone and set the table for this. And how we're going to think, how we're going to function I think there's going to be so much cross-sectional work coming, and it will be the way it's happening. So absolutely, I agree and endorse that 100%, Cliff. I hope Wendy got that all well down in the notes, and would happily work with you and others on that. Do we have others who have comments on this? Are we generally favorable? Can we see a thumbs up or something on this in general? Great. I think we should do that, Cliff. So if we want to take the, if anybody wants to work with us on that, we can draft that. I think that'd be a good way to handle
I
it.
know there's another volunteer out there. I'm not going to mention her name.
Let's go. Call them out.
But she knows who she is.
I'm happy to help. Thank you, Cliff.
Oh, is that Secretary Burke? That's Secretary Burke. Fantastic.
Yes.
In the highest sense of the word, right?
Exactly.
Thank you, Camille. Camille just volunteered Mary Beth Haller, I think. So there you go. Now she's shaking her head. Fantastic. Is Jack back on the line, since we're talking so much about the work that Jack does? Is there anybody else from the Department of Housing and Community Development? Okay. Let's move. Can we go back to the agenda there, Wendy? And okay. The Housing Authority of Baltimore City, their HUD grant program. Is there someone here to talk about that? Mary Beth, or Camille, do we know what this is?
It's actually DHCD. It's not HABC.
That's what I thought. I'm just catching that right now too.
And I'll have an offline conversation with Wendy correcting that later on lots of other places. I know that they just got started. Catherine just texted me. I know she's on the way, but she's sitting in a meeting, but I will definitely let her know that she's up next month. What I don't have, and I may have to get from Wendy, is what was presented in the past. There she is. There she is. Thank you, Lord. Thank you.
Great.
Hey guys, I just stepped in.
Yeah, do you want to update us where we are on this program? And I know we're just starting to move, hopefully some dollars really strongly out the door. Is any new plans or updates on the city-led?
Yeah, so we have been doing unit production so far, and we have been increasing as the quarters have been passing, which is great. We have been having a lot of staffing issues, which has really impacted how much we can do at the same time, but we have made some huge progress in regards to getting unit production done. We are expecting to get a whole lot more done once we have a contracted bid approved by the board. So we're expecting to have more contractors on board with us to really start helping more units, because we have a whole lot of money to spend and we're just looking for those opportunities to really use it. So we would love if you guys ever have any referrals or outreach opportunities for us to really promote the program, to get the public aware that we are there to help. We would love those opportunities. I can also drop my email if you guys have any ideas on how you can also help really get this program up and running since COVID.
Well, Catherine, first of all, thank you for taking on this challenge and coming in and in the relift of the program, and appreciate you being there. If you share with the commission any kind of marketing materials that you have, that would be great. I would encourage the Department of Environment, the Housing Department, the Health Department, if there's ways to put it up on their website or in mentions that they do, or anyone else. If you share that with us at GHHI, we will put it in our newsletter and through Baltimore Connect and other places to do that. If I may ask you a question about the contractors, have you all adopted how you are tracking equity in this, in terms of not only the families served, but the contractors, and contractor companies, and how the city may be working to build capacity for community workers to become contract company owners, if you will. Are there efforts underway with that, or anything that we could learn about?
Yeah, we actually have been in discussions lately on how to really expand the contractors that we have. We do monitor the contractors that we currently have by even figuring out which ones are low income versus not low income, and getting them certified to do lead work. We are in the works of trying to actually have an in-house training facility for contractors where we're offering them RRP training and lead inspection training. So that is in the works right now to really get our contractors not only to really do good work for not only our lead program, but for other programs within the city, to really get things going with us. But we do track them. We have our field staff that are constantly going out to our unit properties that we are currently working on, and we maintain conversations and contact with all our contractors to make sure that the work is being done correctly and lead safe for the community.
Fantastic. Does anyone have any questions for the city?
Yes, Ruth Ann, this is Susan. I would like to ask Catherine, as a lead tech services, as a lead training provider, if you would we certainly could help facilitate training courses. We're accredited both in the abatement courses and also the RRP, that if you wanted to do in-house training, we would certainly welcome that opportunity to assist you in that.
Oh, that's awesome. And can I get your name?
Sure, Susan Kleinhammer. You can contact me, via email or phone. Be more than happy to talk to you about that. Maybe the best way would be to give me a call. I can give you my office number is 410-321-7663. I'd be more than happy to help you with that.
Awesome. Thank you so much, Susan.
You're welcome. You're welcome.
Catherine, I also wanted to mention, this is Dawn Joy with AMA Training. We already do train many contractors. We also work with many state agencies currently to train their employees in abatement, inspections, risk assessment. I will send you an email to also give you our information. Also, I didn't know if you were aware that there's an organization called Be More Green Civic Work, and they do train people in asbestos and lead currently. I believe they have actually suspended for COVID, but I'm not sure if they're about to restart. Okay. And you may also be able to get some already trained people through them. And they are an agency that trains people mostly from the city to have careers in abatement, asbestos, and lead. So that would also might be a good resource.
Thank you so much, Dawn.
Oh, sure. I will send you an email with the information.
Yeah, I'll drop my email in the chat right now.
And Cliff has his hand up.
Absolutely. And if I can, if you will please put your hand up so we can call people in order rather than just speaking, so we can keep it. Thank you. Cliff?
Yeah, no, I recognize for the phone people, that's a little bit more difficult.
Yeah, that's true. That's true.
Yeah. Catherine, it's Cliff, and I wonder, have you thought about outreach to medical providers? One of the things, and you know, Paul, I'm going to volunteer you and me. But if you've got materials that are specific, and I would be willing, and so would Paul Rogers. It's just the spirit of giving in the new year, Paul.
And Neil, don't worry, somehow you're going to get volunteered too. So
to think about, because I think, you know what, where a lot of this conversation could potentially happen is in physicians talking with families about resources available to them for lead abatement, which is one of the big conversations that happens in the provider's office. I wonder if it's worth thinking about some tailored materials which we could help distribute to healthcare providers.
Oh yeah, we definitely have materials that we can also give to healthcare providers, which we have been trying to link even better relationship with them. Because even just trying to, when we do our work, we need to also know if there's the child's being tested for lead, period. So we have to talk to these primary care providers to really understand, okay, has a child been tested before? And we do it before we do work and after we do work. So having that relationship of even them providing like our marketing materials to the family so they're aware can really go a long way.
So I'm thinking that what might be helpful in this case, it's important to sort of think about targeting the providers directly with some pointed materials, which are short, easy to read, and just give them some information to pass along to their patients. I think we might think about a distribution in Baltimore City, Baltimore County, and Anne Arundel County, because there are people who see children in all of those jurisdictions who would be within Baltimore City.
Oh yeah, and we also cater to visiting children. So if a child is from another county coming into Baltimore City, spending the weekends with their parents or their grandparents, we're able to still work on the homes for visiting children as well. So we not only can distribute to within Baltimore City, but within outside of Baltimore City, if they're aware that their child is visiting Baltimore City pretty often.
Well, I'm happy to work with you on that, and obviously with Baltimore City Health Department as well.
Awesome.
Paul, your hand is up.
Yes, I'm certainly willing to help out. And we've had this question come up in our echo sessions a couple of times. The pediatricians ask, where can we get information about rebate, about abatement, also about cost and funding for it too. That's a big issue that comes up in there too, funding. And so that I think would be really, really welcomed.
Absolutely. And thank you so much, Catherine. I hope all of this is helpful, and there's many resources here to rely on as you have questions. We're here to be support, thought partners, and partners in getting the work done with you. Thank you for doing this. If no more questions for Catherine, can we go to what is next on the agenda, please?
Thank you, guys.
All right, that would be commissioner membership renewal update. So I just wanted to let everybody know.
Wendy, thanks, but we have to go back to the legislation.
Hold on.
The agenda. And Tyler, before Kaylee left, she had reached out to me about pending legislation from MDE. Is there pending legislation from MDE being proposed in this legislative session?
There is not pending legislation being proposed, and we would like to work with you a little bit more in the interim so that we, work through a couple of different issues and, bring all stakeholders to the table.
Okay. Adam or Anna, are you aware of any legislation, or Mary Beth from the city, any legislation that you're aware of impacting lead?
I haven't seen anything yet.
Not presently.
It might be the first session in 25 or 30 years that we don't have something. Right?
Yeah.
There will be, I do want to say this, there is going to be a bill from Delegate Stewart that is addressing whole house, trying to replicate, in fact, the sort of the guideline work of the Green and Healthy Homes Initiative that was taken up by the Philadelphia Energy Authority and then adopted into Pennsylvania law and funded by the legislature in Pennsylvania to do, Cliff, kind of getting to the point earlier, whole house approach to how do we repair homes, how do we align dollars. And so that legislation, which we will ask Delegate Stewart potentially to come next meeting, Wendy, if we could, to present, and we will have a copy once the legislature opens. They're not allowing copies out of pre-filed bills at this point in time. They're waiting till the legislature opens in this session. But I think it's something that we will want the commission to look at, something that in concept, clearly in my work hat, we wholly support the alignment of energy, health, safety, and lead removal together as an aligned way of approaching housing condition upgrades and repair and retrofits. So that is on the agenda. There is also a bill that was actually approved by the legislature but vetoed by Governor Hogan, which we have discussed in the past, which is an energy efficiency bill that will guide investment to ensure that low-income families are getting sort of the appropriate level of investment based on their contribution to Empower funds to ensure that energy efficiency happens. In that, they also call for a commission that looks at the whole house approach. So this is something that looking at that and looking at the future of how all of this work is done, we should pay attention to. So because it's a new legislative session with new administration, those bills which have been pre-filed will be available, I think, on January the 11th, if I'm correct, and we will get them out to the commission members. Is there any other comment or question on legislation? Okay. All right, now we're down to new business, which is commission membership renewal updates. Wendy, do you want to take that?
So I did send everybody out. So great news that we finally have everybody that is on the commission serving as a commissioner. Everybody is up to date on their term and reapplied and all that. So everybody's current. There are going to be in 2023 in September. So Jack Daniels, Benita Cooper, Jacob Benzakin, and let's see, Barbara Moore and Anna Davis. So I'll send you a reminder like in the mid-year, probably before we break for the summer, but you'll have to reapply. And then, yeah, so every year we'll have to do that. We have some terms that end in 24, some that end in 25. So that'll kind of be an ongoing thing every year, but I'll send out reminders for everybody so that we can make sure everybody stays current. So that's what that was about.
Okay. I saw the two that are vacant.
Oh, yeah.
Names that have not yet received appointment by the governor. So will be moved to the more administration, right? And Barbara, that would be so wonderful if you would send a letter. And the Secretary of Appointments, who is in charge of this through the governor's office, will be Tisha Edwards. I think at this point, I cannot imagine that the Hogan administration is taking on appointments. So on January 19th, we can get a letter delivered to the new Secretary of Appointments and to the new Secretary of the Environment, or Secretary Designate of these positions, certainly. But we would love to have a parent active on the commission, and thank you for that. And we will work to fill the vacancies for these matters that are in front of us. If you have suggestions on people, please send them to Wendy and myself, and we will work to get them advanced. Okay, Wendy, you want to pull up the reporting calendar for 23 and the meeting?
Okay. So what I did is just copy. Let me see. I gotta represent on a different screen. Give me 1 second. A tab. See calendar. MDE legislative calendar. Here we go. Should be coming up. So I copied. See, we just need to come up with, I guess, a yearly thing here. These are things that I think had been reported in the past. And we could always adjust and change, remove, or add new things. So For February, I didn't know if we should keep these on, take them off. This lead grant program, the HUD grant program. So that's kind of what I need you guys to discuss and let me know who wants to present which month, what presentations you want. But this is kind of like the outline from previous years that we've had.
So a couple of things. One, we just had a quick update by Catherine with it on the calendar or on the agenda today, and appreciate Catherine's flexibility from the city of Baltimore. We do need to correct that HABC to be Baltimore City Department of Housing Community Development. I would like to ask these departments that have issues of unit production and dollars that they would provide quarterly updates, share quarterly updates with the commission of both funds available, who they're available to, and the units done to date, and let us know so that we have a good sense of that, especially for the state. What I would ask of the HCD is a mapping that would be able to be crosswalked against where we have children under 6, where we have lead levels being reported, and where we have dollars going against that, and age of housing. Baltimore City's obviously a very confined jurisdiction. And I think we need to work at the commission level to have a mapping of who has lead resources across the state, whether it's Baltimore County, Baltimore City, or others. And Wendy, I will volunteer our staff to help put together a resource mapping of what programs also support both lead, hazard control, source control, water, so that agencies and the public can have that potentially on the websites of the state. And we'll get down to the annual report in a minute, but I'm going to urge, and I think it will be urged by the next administration, that in this is tracking of equity and where dollars are going, who they're going to, and how we are moving in that direction. I see 2 hands. I don't see anybody from the phone or hear of anybody from the phone, but Camille and then Cliff, please.
2 things, and I may end up repeating Cliff, and I try not to do that. For Baltimore City, our report in October, we're happy to do it, but I say this every year, and I really mean it this year. I want to look to the Howard counties, the Baltimore counties, the Prince George's counties, the Anne Arundel counties that are doing this work and doing it really well. And I don't think we know as much as we possibly think we know. So I want to give them the opportunity as well to present about their program, to make sure not only that we're aware, but we also can provide them support. That's the first thing. I wanted to make sure we did that. And also for Cliff and also my other commission, I want to also make sure that the Lead Commission is well aware of the environmental health tracking at MDH and the EJ screen at MDE, because they're great tools that can be used. So we might at some point want to fit in presentations or just something very brief, and if we need to provide paper, we can do that so folks here can see those screens as well. So I apologize, Cliff, if I'm repeating.
Can I just simply ask Cliff and MDE if you would please present those trackers next month, so that there is clear awareness of those trackers, what's on there. And Cliff, you're nodding your head, and Tyler, yep, great. So Wendy, for next meeting, please put at the top of the chops those 2 presentations, because how we track things, how we measure will be so critically important. And Dr. Mitchell, you had your hand up.
So wait a minute, for February, what title do you want me to put it as?
I think we can put it
Publicly available lead data.
Yeah.
And mapping.
Mapping. Yeah. How we're, just mapping and tracking.
Yep. It's actually mapping lead data and health equity.
Yep. Great.
Thank you, Camille.
And that, okay, so what two organizations was that?
MDE and MDH.
Okay. Sorry.
Which are not the same agency.
Yeah, but they are not the same agency, even though I apparently don't know the difference between the two of them. I put the portal, the environmental public health tracking portal in the chat box. I'm sure Tyler or somebody else can put the environmental justice tracker URL in there as well. And if you go to that those pages, you can look at the new versions. Our new version of the portal is up, and so is MDE's.
Yep, I'll pull it up right now.
Okay, you're trying to pull it up right this second, or why don't we? Are we going to wait till the next meeting and go over them?
Sorry, I meant that I'm going to put it in the chat.
Okay, gotcha. Understand. Okay. Other questions on this reporting calendar? Tyler, the thing I would just ask is on the MDE report as it goes to the governor moving forward, that it very clearly track equity and environmental justice. It's a hallmark of the new governor's platform and commitment. So happy to have and would those on the commission to work with you on how that report format might reflect these matters. Okay, Dr. Mitchell.
My only other comment is about the March report on lead screening. This is complicated because we really work, the Department of Health and the Department of Environment work hand in hand. And we don't really, because we work so closely with the Department of the Environment, it probably makes sense to talk about that in the context of the MDE annual, the Childhood Lead Registry annual report in the probably November, December timeframe, not the March timeframe.
So which one? Pick a month you want.
Well, I would defer to Fred Banks and Dr. Boss Victoria as to when they present the annual report, but it seems to me that presenting because we look at those data as part of our screening data, it probably makes sense if you're not going to do it in the same month to do it the month after. Or 2 months after, something like that.
I know Fred is on, but I don't think Rena's on. Fred, do you have any comments on that?
Yeah, that sounds good. If you're doing, we can do the month after if that works for you guys.
Yeah, no, we're happy to do that. So we would probably do it the month after because we will use the annual report final data from MDE to calculate screening rates and also to think about what our initiatives are going to be for the next year for outreach to providers to improve screening.
Sounds good.
And I'll have more to say about that in a few minutes.
So you want me to put that on for December? Is that what the decision was?
Yeah, if you're doing the childhood lead report, yes, then December makes sense to me.
Okay.
And in that case, it probably makes sense to move the reports from counties on lead case management to sometime, I would say, early in the year, like February, March, in part because December is a tough time to try to get the counties. They're involved in a lot of activities in December. It's a tough time to get them all together. I would think about doing them in February or March.
What line item and month are you looking at?
Move the report from counties on lead case management, line number 1 in December, and move that to the March timeframe that you just deleted us from.
March. Okay.
Yep.
Okay.
Let me circulate.
Any other comments?
I think what we would ask people to do is look at this. If you do have comments or markups send them to Wendy, and Wendy and I will discuss that. And then Wendy, I think there might be some new elements added to this, but one I would think we need to have is an update on the lead and water, like where that is as that moves forward in the state. And there should be on each one, and we should have an update on new opportunities to support lead hazard control and lead source exposure through other programs. So we should maybe quarterly update those efforts. I'd also like us to highlight good community efforts across the state, at least 3 to 4 times a year that are happening around this work, or highlight a nurse or a case manager or a community organization. So Wendy, I will work with you on how we do that, but I think it's important that we know who's working on this other than the echo chamber that we sometimes have, and lift those efforts, and would ask also that people on this call contribute to that, because we certainly want to lift those efforts as we move forward. Hearing no other comment, can we move to the rest of the agenda, please?
All right, so the next item is just confirming and letting everybody know of the meeting schedule for 2023. These are the months and then the dates that we'll be meeting. This will all be on the website, for the Lead Commission website. Whoops, it's not coming up. Hold on. Stop presenting. Let me restart the present meeting schedule. There we go. All right. So yeah, this is just indicating the dates of the Lead Commission, which is the first Thursday monthly, same time, 9:30 to 11:30. I don't think any holidays or anything falls on any of those dates, so they should be solid.
I do think we should pay attention to what the call to action is when the new administration takes hold about meetings being virtual or in public meetings. And so we'll pay attention to that as well, about resuming in person potentially in 23, but we'll give good notice if that occurs. Any questions on that? Okay.
Yeah, Ruth Ann, just Susan here. I just wanted to know whether or not we couldn't revisit the issues. They kind of were dropped in terms of talking about, you know, the permit process, especially in the city of Baltimore, requiring some documentation of lead training by contractors pulling permits. And also, I think we had kind of dropped the ball on talking to the Maryland Home Improvement Commission on their efforts to help us get contractors lead trained who are working in pre-1978 properties. I still think this is an avenue to explore further to get better compliance and to prevent children in remodeling and renovation activities from having unnecessary exposures to lead.
Okay, great. We will, Wendy, you and I should reach out to get MHIC into a discussion. If there's a committee of the commission who would like to talk to MHIC, Susan, I think you're one of the volunteers. We'd like to get at least 3 people to do that together before we just put them on a commission meeting and start hitting at them cold. So I don't know, Adam, I see your hand up. Maybe you would volunteer on that too, but let me.
Happy to help.
Sorry?
Happy to help.
Great. But you had your hand up. Do you have other things to add other than you're happy to help on that?
Nope, that's it.
Okay, so Susan and Adam, thank you. Christina?
Yes, I was going to refer back to the schedule for 2023. It looked like May 11th. That's the second Thursday. Should it be May 4th? I'm just checking.
Oh, good catch. Wendy,
Yeah.
could you just correct that if that's correct?
Should be the 4th, the first Thursday. Just checking the calendar.
Okay, thanks for doing, yeah, I'll get that corrected.
Sure, thank you.
Fantastic. And I think, Susan, thank you for the 2 good ideas. On the Baltimore City one, Susan, could we facilitate a call? We'll try to get Catherine and maybe Mary Beth. Would you mind participating in that so we could address whatever the issue is here and then bring it back to the commission?
Sounds good. Thank you.
Mary Beth, is that okay? Okay. And Catherine, are you still on the phone?
Yeah, no, that's fine with me as well.
Okay, great. Wendy, so if we could, you could help us to facilitate those 2 meetings, and then we will reach out to MHIC, Baltimore City. We can take a little more straight head on and see what we can do. That I loved, by the way, the idea of having the city present its resources. State should too, to doctors across the state, just FYI. So appreciate you taking that on as well. Mary Beth, if I could ask you to bring to the February meeting just the update and status on how the city of Baltimore is tracking lead violation notices and sort of the status on how well we're doing on that. It was raised to me recently as an issue, just that people know or don't know, right? And I had an advocacy group say nothing's being done. I think things are potentially being done. I think it'd be a good platform to let people know how the city does this. If you wouldn't mind in February bringing that forward.
Yeah, I can work on that with Camille.
Great, that would be wonderful. Thank you. We already covered, I think, legislation here, right?
So the next thing here is the annual report, and that's just I included that in the materials. So it was like a 5-page report that the Lead Commission needs to report to the governor yearly. So that was signed and sent out. That's for your reading pleasure, and it basically summarizes what the commission did during the year. We are also to include all the agendas, all the minutes, so they're also included. So it's a pretty large document there. But all of this material is also on the website, the Lead Commission website. So that's just for your reading pleasure if you wanted to get a sum of what we did.
Okay. And Wendy, as a matter of course, you've emailed that to every commission member as well.
Yeah, this this was a 69-page meeting material that I sent out, which included all, November, December minutes, but it also included the entire annual lead report. So everything's included in this PDF that I sent out yesterday to all the guests and commissioners.
Got it. Understand. Thank you very much. Are there any questions there? Any hands up? Christina?
No, I forgot to put it down. Sorry.
Okay, no worries. All right, moving on. From these agencies, because we've heard so much from them, I just would say any new updates from MDE?
Yeah, so I just wanted to mention that Secretary Tablata has retired, and now Suzanne Dorsey will be acting secretary until a new secretary is appointed. And be on the lookout for a few more reports from us in the near future here with the House Bill 1110, as well as the childhood blood lead surveillance report. And that's it for me.
Would you be able to give updates responsibly in February or March on those 2?
Let's probably plan for March. We're working on just finalizing some data, but we'll plan accordingly.
2 people there. So if, Wendy, if we could put MDE on to report on those 2 items in March, that would be great. Thank you. Thanks, Tyler. I know you've got a lot of people that left you, so you've got positions to fill as well, right?
We do, yes.
Okay.
We're working on it.
I gotcha. MDH, Cliff.
So a number of things to talk about. First, MDH has received from the Association of State and Territorial Health Officials a substantial grant, which was made from CDC to ASTO and distributed to several states, including Maryland, to improve lead poisoning prevention and case management activities. So we are in the process of discussing with MDE and with local health departments how that grant will be used. It goes from August of last year to the end of July of 2023. Most of it is going to be used to support lead case management in jurisdictions that are not recipients of funding already, primarily through the Medicaid CHIP program. So there are 11 jurisdictions that are currently supported through Medicaid CHIP, another jurisdiction that has some additional local funding, but there are 12 local health departments that don't get, from at least from the Environmental Health Bureau in my office, any funding currently. And we're going to be supporting lead case management, which is particularly helpful this year because of the expansion of potential case management kits in the 3.5 to 5 micrograms per deciliter range. So it would not, for each of those jurisdictions, it probably won't be the equivalent of an FTE, and people won't be able to hire people, but they will be able to support lead poisoning case management activities with their current staff, and that will help them a great deal. Part of that funding will also be used by us, meaning at the state level, to help support lead poisoning case management, and we're discussing with MDE ways in which we might use those funds to help support both MDE and MDH's case management and prevention activities. So thanks to ASTO and CDC for that. That will be very helpful, given that there are other resources at local health departments that are not available this year to support lead case management. Second thing is that we've had some recent conversations with the Department of the Environment about the development of a dashboard for healthcare providers related to lead poisoning testing, lead testing, and follow-up. And so we're in the beginning stages of talking with MDE and our epidemiology staff about how to use the lead case registry data to develop a provider dashboard or provider report card that would be used to help improve testing rates and follow-up testing on the part of healthcare providers across the state. It's early for us to do that, but Shamola Dai, the epidemiologist for the lead case register, for the lead registry, and our epidemiology staff will be working on a provider dashboard, and we'll be reporting to you all about how that goes as that develops. And then I think other than that, we are in the process of, we'll be having another quarterly meeting with all of the lead case managers across the state, with MDE this month to talk about lead poisoning activities, prevention activities. And I am going to be presenting to the health officers at next week's health officer roundtable an update on lead poisoning prevention and associated activities.
Thank you. That was amazing. And just as always, so good. Baltimore City, and then MD AAP, and I have to go offline for just a second, but if Mary Beth and Paul, you could report.
I'm actually going to jump in. I don't normally do that with Mary Beth, but in the spirit of just asking about violations, we just finally received, after lots of back and forth, the list of everything that's been demolished in Baltimore City in the past 2 years. So we are painstakingly going through every single violation that we have, our vacant and boarded list, everything that we have, and comparing it to that list to hopefully reduce the violation list. But we literally just got that not 2-3 days ago. So we're literally going through that now, and we are hopefully finally getting towards publishing the new lead abatement regulations. We've been going back and forth with the law department on verbiage, so you should see those soon as well. And that's all I have.
Anybody else from BC HD? If not, we'll go to Mr. Rogers. Oh, Dr. Rogers, sorry. I did it again. Oh, Dr. Rogers.
He was my hero. He still is my hero. That's okay. You can call me Mr. Rogers. That's a compliment. We just had
You
our
need a sweater, Paul.
I've got it, but not the shoes. I had a 6th meeting with our through the ECHO program, which we've enjoyed support from the commission as well too. And during the case discussion, we had lots of questions come up during the discussion. A lot about some frustration the pediatricians are feeling with all the paperwork to fill out with lead poisoning related issues. Also, lots of questions I couldn't answer. If a physician is doing point of care in his office or her office, and if it's normal, do they have to report that or not? And do they report an elevated POC reading, or they wait till the venous reading to report? So all kinds of questions. So Cliff, turnabout here. Could you give us 10 minutes maybe at our next meeting?
I'd be delighted to.
It's February 1st, 12 to 1 o'clock. I'll talk to you more about it. But if we give you 10 minutes and answer some of these questions, and I'm glad to hear about the dashboard. That made me need to maybe expand it maybe even further the dashboard, maybe to a website that's a primary site a physician can go to get answers to all these questions. But we can talk more about that. As I said, if you can volunteer to help us at our next meeting, just 10 minutes, and it's a Zoom meeting.
Great.
Great, thank you.
Paul, thank you so very much. Appreciate that. We will have to get HABC and do a meeting with them to find out what they are doing on lead. I will call Janet Abrams and see if we can get at least a periodic update. I think we've had a lot of update today from DHCD. I'm not sure there's other things here, but I would ask that we all think about the capacity building support there. And Jack, we skipped over you because we didn't know that you were back yet. Sorry, or I didn't know, and I apologize. Would you like to just say anything?
No, I apologize. I did have my camera off because someone had walked into my office, but I have been on for that. Nothing incredibly pressing, just like Tyler had commented, Secretary Holt has retired. Acting Secretary is Owen McAvoy for the time being, and we will wait for Governor-elect Moore to sort of make any sort of decisions. Obviously, it will be a bit of a transition period for them for onboarding. And if there is a change, we're currently working through our pipeline, both through our Healthy Homes for Healthy Kids initiative and Program 1, as well as our MOU with Baltimore City and Catherine. We recently have had some staffing issues, both internally through our special loans and energy programs, as well as down in DFA. So we're trying to work through some of the kinks that have caused some delays in payment and stuff like that. But we're working through that pretty much every day. I'm downstairs with the director of accounting to try to iron out those issues. Working on some other programs that have leveraging opportunities with lead from that piece. So we are consistently trying to do that. So currently at the moment, that's pretty much the updates. And then obviously in February, I will be giving our lead and other reports for the commission.
Jack, as you may or may not know, the transition committee is meeting with Department of Housing and Community Development tomorrow. One of the questions to be posed is the status of the CHIP program, where it stands, how much money's in it, what's the average, what's the path forward. So to let you know that that's going to be something that request that we can talk about offline. MSDE, I know we have a new person here. Any updates there, or Mangela from the Office of Child Care?
I don't have anything today.
Okay. Mangela, do you have anything?
No new information related to lead exposures.
Okay, got it. Insurance.
No, nothing new at this time.
Right. Okay. Well, for GHHI, let me just say two things. We have a new case manager who will be on the call next month with us, working on lead, adding to our staff. So I'll do those introductions next month. And we continue to try to work with the state to refund the deep need on legal services there. Wes, you're there. So do you want to talk about the new case manager that you have? And then I'll want to talk about the homes that we're seeking applicants.
Yes, well, as Ruth Ann mentioned, we'll introduce her next time. Angela Perry Hall has joined, who will be a lead case manager.
And and for Baltimoreans, that is her name, Perry Hall.
And in addition to lead, family advocacy and case management, she will also be charged with the relocation assistance funds and the housing choice voucher lead preference program assistance. So we'll give you more detail on that. The only other thing from GHHI was we did, with some EPA funding, have a community meeting on lead and water, and also one upcoming on air quality. And one thing for the commission to consider is, with the substantial funding coming from the Inflation Reduction, from the infrastructure bill to the state of Maryland, the commission may want to look at how those funds are going to be distributed. We had a terrific report from MDE, and they presented to the commission mainly around the question of how much funding is going to be spent on actual, testing, how much is going to be spent on researching where the service lines are versus going to remediation. And so I just know that was an issue that for the commission may want to look at that distribution and how that's going to be spent. It was somewhat concerning, the amount from our perspective that was going to be allocated to just determining the lead service lines versus going into remediation. So I just raised that as something. The state is also, based on the legislation passed last year, the state is tasked with doing that with the local jurisdictions as well by legislative directive. So again, how that's being paid for, just something for the commission may want to consider looking at.
Great. And the last thing I will say is our team at GHHI has done quite a good job of pulling together a very good fund supported by everything from the U.S. Senate to philanthropy to the federal government on a whole house program. We are seeking Baltimoreans who live in older housing. It is not limited to children under 6. It's not limited to seniors, but it is, we are looking to improve holistic housing condition. We are offering in that package for at least 1,000 homes in Baltimore. We will be doing lead hazard control, full weatherization, asthma reduction, indoor air quality work, along with those homes that opt in to do full electrification and decarbonization. And we will be measuring very tightly all of the costs, the outcomes. We'll be sharing this publicly. We are doing a study on the impact of lowering carbon emissions on asthma. We are doing a very tight study on what it will cost long-term for low-income families to move to electrification. Hopefully looking at both the benefits and any unintended consequences there. We are going to be measuring contractor, how we're paying contractors, and looking at health and racial disparities and equity. If you have any opportunity that of families that could use these upgrades in their home, if you have property owners who could benefit from having these funds, Adam and Jacob and others in Baltimore, we would greatly appreciate referrals, because this is not going to be a one-shot deal. We're going to look and do a comprehensive scope and improve all of those measures that are needed within the home to ensure that seniors are living with dignity and health and safety, our vulnerable children and our families. We hope to increase housing stability and health and opportunity by doing it. If you're interested, we can come and talk to any of your groups. Paul, I'd love to talk to the doctors if you have it. And if you want to get directly more information, I'm going to give you the really important email here, which is either info@ghhi.org, which will get you into our intake, education and outreach team, or to the lovely man in front of you, Wes Stewart, and his email is gwstewart, STEWART, at ghhi.org. Maybe, Wes, you could put those in the chat, and we will get to you immediately. And we also will be looking to expand our contractor pool. And we are doing this in coordination and alignment to support the city on its spend of lead funds and others, not in competition in that. We want to get as many low-income homes in Baltimore to raise the standard of housing condition, whether it's single-family homeowner, scattered site, rental, or multifamily. Happy to answer questions there, and appreciate anybody that you can refer for that, because we want to show what can be done in this alignment of private and public sector, and help to improve Baltimore as a model across the country as we do this. Anybody have any questions before we conclude? Any public comments?
Oh.
Yes, go, Barbara.
I just have a question. It seems like a lot of the government agencies are not receiving our emails from Mount Washington. And I don't know if it's because when we send it, we have to label it as confidential and it gets encrypted. But we're all receiving bounce backs 2 weeks after they've been sent. So if anybody has any ideas of how to make this work smoothly.
Barbara, how long has that been an issue?
It was an issue about, I don't know, maybe 6 months ago, and then it seemed to get better, and now it's happening. It happens with GHHI, it happens with MDE, it's happening with Baltimore City. Some people seem to get it and respond, and other people, we were starting to think everybody's just going to ignore us, and then I thought, it's happening too many places.
Okay, Barbara, talk to me offline. And I will talk with my team. I did not know Mount Washington was getting rejected by our system, but we can get that remedied in about 30 seconds for sure.
Okay. And then if at some
Barbara?
point, yes.
Hi, sorry to interrupt, but I thought, the department has had its challenges with IT over the last year and more. You may need to talk to us about the possibility of being whitelisted as a domain, which is to say we may need to, and that may be true not just for us, but for local health departments, because if they're part of Maryland.gov, you may be falling into the same bucket in all of those cases. So it may be possible to whitelist your domain. I don't know, but send me an email with a description, and we may be able to hook you up with our Office of Enterprise Technology to see if you can be a trusted partner.
Okay, and it's very inconsistent because some people do reply back. So
Yeah.
It's like some people are getting them, and I think others, it takes some effort to get to the actual email.
Yeah.
I don't know if that's
So
it.
and that may depend on what the domain is. So just send me an email. I
Okay.
did get the one that you just sent, by the way.
Yeah, I didn't label that one confidential,
Yeah.
but I can try it. So,
Barbara,
yeah.
we're
yeah.
sending one labeled confidential to me and to info@GHHI right now, so I know what happens to that, and we'll talk offline too, because that's critical to us. You're a critical partner. Anything else for the?
No, the other issue was, I don't know if other people are seeing this. When we're getting reports back about inspections that are being completed, there's a lot of inconsistencies in what is being tested. And I don't know if there's a basic group of areas within a household that are supposed to be tested. We've gotten feedback, some saying, oh, we just test where the parent says there's a concern. We've gotten other replies back that, oh, we didn't think the child went in that area, but it's a bedroom or a playroom. Spices are not consistently being checked, even though we keep getting reports that when they go back and do test spices, yes, that was a potential source because they were positive. And if that's just something at a future meeting, maybe we can look at, or another group look at what is being tested.
So Barbara, I would like to take that on right now. And Tyler, I hate to do this again, but is there somebody from MDE who could join in a subgroup to look at this and be able to report back in March, give you guys a couple of months to look at this? But I do think there has to be a uniform standard. You know, this can't be artistic feel in how we're doing this, really. There has to be really good guidance. Susan Kleinhammer, if you're on the phone, I'm not sure if you or others from your field would like to join this. Neil, you're shaking your head, but I don't want to volunteer you for too many things. But is there somebody from the city health department, from the inspection side, who would like to join this, have a uniform discussion on this?
That unfortunately is me too, but I'm happy to let Tyler know what we test. But as Barbara knows, every household is different. There are absolutely some uniform things that we test, but if it spices or something that's just, it's a whole different conversation. It's not something we normally test, which is why we have conversations with the household before to let us know what those special things are. And spices is one of those things, or toys or that kind of thing. So I'm happy to have a conversation with Tyler or send him what we test.
Yeah, I would love us to have, and certainly Tyler, from a commission standpoint, I'm happy to help make sure this is happening, so that we have, and Jonathan will get to you in just a second, but that we have like a better knowledge base on this. I think it is really important as we look at this, and there's going to be a lot more as we're putting climate dollars in that are going to require lead. We're going to be getting a lot of sort of holistic assessments here too, and what should be covered. What are the questions in also case management being done by nurses and by organizations like mine and others. So if we could get a group together, as you may see, I'm trying to push a lot to interim discussions so that when we come to the commission, it's not just we raise a problem, but we're starting to raise some way of solutions and actions as we move this forward. Taylor, let I talk offline. Jonathan from MDE, yes, sir.
Yeah, I was just going to mention that there are regulations regarding the environmental investigation. I wrote those with Erica Chapman's assistance, 261608. So it does outline the testing procedures and the protocols regarding, and it basically points out the guidance that was provided in HUD Guidelines Chapter 16. So we do follow that to a T. There are we first start off with the environmental questionnaire, and then that points us in the direction. So sometimes it's based on what the parents provide us, the information at the point and at the time of the environmental investigation. So if they do not disclose certain things, where the child plays, where they spend areas, you know, their diet, things of that nature, and then later on we do receive requests, hey, can you come back out? You know, that is, you know, it becomes a problem, you know, of us having to try to schedule these things, you know, along with the amount of blood level referrals that we're receiving. But I just wanted to point out that there is guidance out there. I have come up with spice sampling techniques, a protocol for that. I had provided that to PG County Health Department, and so there are required testing procedures and protocols that are in place, and I'm open to sharing that with anybody if you guys want to take a look at that, and feel free to take a look at the COMAR regulations that we've drafted. Thank
Well,
you.
let's have an offline discussion in between that we are hearing around healthcare and others who are wanting to understand how we can accomplish certain things, and just get a refresher. And Jonathan, maybe MDE and the commission can sponsor a public webinar on training on what does a lead assessment look like, and so people know, and we can have parents join and others who may be interested, or it's a reported thing that we can share. I know we would have put it on our website to do that. I think it's really important more and more that we tell people what's going to happen when people enter their homes anyhow. And it might be just for the nerds and all of us to know what's going on here. But Barbara, we'll try to also hear the concerns and try to have a response back that is helpful. All same for anybody in the healthcare side that you're working with that may want to know this. And I will have Hector Morano from our team and Angela, our new case, Angela Perry Hall, join, so that Hector does a lot of assessment and testing. And but it's always good to do this and have this discussion. Is there anything else?
Ruth Ann, you had asked, and I would be more than willing to participate in that sub kind of committee. If you wanted.
Yep, Wendy, if you would note that as well, that's great. Tyler, if you would help drive this to pull this together, or somebody on your team, since you're the big dog on this one, right?
Yep, I will. Talk with folks internally, and we'll set something up.
Great. And Paul, if you'll include Barbara in the meeting with providers, we see that too. That's great. I like the crosswalk on things here. Any other comments from the public or from the commission before we close? Congratulations on a nice, tight, 90-minute, effective, thoughtful meeting to kick off the new year. Better we have effective meetings than long meetings, so appreciate that. Give you a half an hour back of your time. Go take a walk, do some exercise, go smile and tell somebody you love them. Happy New Year to everybody, and be kind. We all need it. Thank you.